Let's stand united, stay healthy, and fight this epidemic together. Thank you. There's no other member who wishes to speak. I'll invite the 5 public officers to speak. Secretary for Food and Health. Starting from the latter part of December, we have experienced a 5th wave. It's been progressing very rapidly. Hong Kong is in a very serious situation, severe situation. We should not be complacent. In view of this, the SAR government has been working very hard and adopt a multi-pronged approach to contain the epidemic. We have been refining our measures, including increasing our testing facility capacity and also enhanced tracing. And we have also adjusted our strategy accordingly. As the CE has pointed out, the SAR government will certainly act in accordance with the important instructions given by President Xi. We will shoulder the major responsibility, unite everyone in the community, and fight the epidemic together. This is our top priority. Last Saturday, I was led by the CS for A to go to Shenzhen for an exchange session. As a follow-up measure, I will be responsible for the expert group on epidemiology study, and I will be liaising with the mainland experts in relation to tracking and surveillance.
As a member of the anti-epidemic task force in Hong Kong, we will do our best to support the central authorities, and we will learn from the central authorities' experience and take their guidelines, and we will have to enhance our capacity so that we will win the battle. We will redouble our efforts earlier on at the panel meetings and also during this debate. With regard to how we can emerge from the epidemic, a lot of valuable comments have been made. We'd like to take heed of those advices, and I'd like to respond as follows. First, on testing. In order to cope with the outbreak, we have already been enhancing our testing capacity so that for mandatory testing and also for whatever we can do in terms of testing, we will try our best. For the permanent centers for testing, we have also set up some 40 sample taking centers so that we will provide better services to the community. And we've also got the support from the contractors. And starting from the outbreak of the 5th wave, the number of testing has been increased to over 1.3 million. And if you look at the capacity in individual districts, it has been increased to such an extent that we have been able to conduct over 1 million tests every day. In fact, for 10 days in series, if you look at the specimen taking centers and also the testing centers, over 200,000 people have given their specimens on a daily basis. And with 2 of the contractors, we have been able to set up the Huoyan laboratory so as to increase the overall capacity to no less than 300,000 every day. And in wake of the situation, the administration has also introduced mobile vehicles to conduct testing, and there are also online appointment systems available. And we have also got disc vending machines in place, and also for those in need, caring teams have also been set up in order to provide convenience, and the response has been very positive. And for the nightly compulsory testing orders, they have also achieve some effect. We have managed to identify more cases, and over 10,000 discipline services officers have also made use of their investigation experience, and they've been working with the CHP in order to conduct tracing and analysis. And in terms of epidemiological investigations, well, the different working groups have also been able to track down to some 31,000 close contacts. Because of the epidemic, we have also increased manpower in order to expedite the work. As far as isolation facilities are concerned, we will do our best to identify appropriate locations to increase the number of isolation facilities. The Panic Bay Quarantine Center has already been turned into a community quarantine center. Some 3,400 places will be made available for those with mild or no symptoms. And we have already identified the following places as quarantine centers: the Queens Hill Estate Block 1 and Block 7, and also Hong Kong block of Lai King Estate will be turned into isolation centers so that and also hotels which used to be quarantine hotels would also be converted into isolation centers. Whole blocks of hotels can also be used as isolation facilities. And the chief executive already met with the sector, and also the Lei Moon Park and also the 350 units of the resort villages would also be turned into isolation centers, and also Hall 1 of the AWE would also be turned into a mobile cabin hospital with several hundred beds. So we will continue to do that, so that for those in need, including those who have been tested preliminary positive, they would also be given a chance to be isolated, so that we can concentrate our resources to deal with the more serious cases. At present, the HA has not been able to take in all the preliminary and confirmative positive cases, and therefore they can only set up a hotline so as to answer inquiries about those with symptoms, and also they would also make suggestions on infection control. And 7 designated clinics have also been set up to provide consultation services for those with mild symptoms and for those who are in waiting for hospitalization. And those with mild symptoms would be able to see a doctor at those designated clinics, and treatment can also be provided to them. As the epidemic develops, public hospitals, 1,200 first-tier isolation beds and also 600 second-tier isolation beds would also be set aside. And in January, at the AWE, from halls 8 to 11, they would also be turned into isolation facilities for treatment. And also 1,000 beds would also be used to accept patients whose conditions have stabilized. And as at 15th of February, we have a total of 2,480 patients that have been tested positive who have been isolated for treatment. And they're mainly in the Infection Control Center and also the AWE treatment facility. And also because of the surge in numbers, Appendix-based quarantine center would also be turned into a communication isolation center for those with mild or no symptoms. In terms of social distancing and also the vaccine pass, the SAR government has already tightened up the measures, and they will come into effect on the 10th to the 23rd of February, and a series of scheduled premises would be restricted in terms of business hours and so on. And starting from the 10th of February, we have already said that for Category D premises, they will have to implement the vaccine pass arrangement, and time would also have to be given to other premises to make preparation for that. And of course, starting from the 24th of February, that would be extended to all the eateries and also those regulated under Cap 599 in order to protect the public. Vaccination has been that we have already vaccinated some 12 million vaccines. Over 6.58 have already taken the first jab, and they have accounted for some 84.5% of those over the age of 15. And we have extended the vaccination hours, and also we would also increase the channels for vaccination in order to increase the number of vaccination, in particular for the elders. With regard to the involvement of TCM practitioners in the process, well, at the different centers in the districts, well, since the start of the outbreak, they have been working very hard to support us in our anti-epidemic initiatives. They have fully played a role that they serve as district-based TCM practitioners, and also for the outpatient clinics, and also for the special TCM services. They have also received very positive feedback, so that will continue. And therefore, both Western and Chinese medicine will work together to fight the epidemic. President, I'd like to take the opportunity to say this to the central authorities and also the support rendered to us by the different provinces and centers, and also to the healthcare professionals that have been working very hard, and also for the volunteers and workers at the front line. We'd like to give them our sincere thanks. And for medical students, they have also taken part in taking specimens from members of the public, and some of them have also helped out with the vaccination for RCHE's elders, and therefore they've worked very hard to tie in with our efforts. And I'd like to send this heartfelt thanks to everybody in the community for working with us in coping with the epidemic. Well, we have managed to withstand the fourth waves of the outbreak. We have also got 7 months where there was no infection at all. And then starting from November last year, we had the national team coming to Hong Kong to visit. And in terms of collaboration between the mainland and Hong Kong in fighting this epidemic, the central authorities have also confirmed our efforts. And we have also maintained very close liaison with different departments and provinces so as to ensure that our measures of achieving this dynamic zero infection targets can be achieved. And that would also tie in with the central authorities' strategies. And we have to be consistent. But then with the fifth wave of outbreak, that has overloaded us. But then we will have to work together in order to cope with the situation, and with the concern and care shown by the central authorities, and also with the help from the Guangdong provincial government, we will work wholeheartedly in order to protect the safety and health of our citizens. These are my remarks, and I urge members to support the motion of thanks.
Secretary for Transport and Housing. President, in the face of the severe epidemic, I sincerely thank practitioners in different industries, such as those in property management, cleansing, public transport, and cross-boundary transport and aviation industries for sticking to their posts during the spread of the epidemics to protect the lives and to minimize the impact to the normal life of Hong Kong citizens and supply of vital necessities as much as possible. At the same time, the SAR government is grateful for the Central Authority's support to steadfastly take forward and enhance various anti-epidemic measures. The SAR is currently following up on matters concerning the vital imports from the mainland to Hong Kong at full speed. And the task force of ensuring vital supplies from the mainland under my charge has held the first interdepartmental meeting to discuss various ways to ensure a stable and adequate supply of imports to Hong Kong from the mainland, as to revitalize contingency plans for Hong Kong and Shenzhen, including the feasibility of water transport and establishing emergency channels to divert and distribute cross-boundary vehicles transporting fresh produce and daily necessities. In order to strengthen information dissemination, the task force the government has improved such arrangements. The Agriculture, Fisheries and Conservation Department, AFCD, will release information daily on the supply level of fresh and live food imports from the mainland, so the public can better grasp such information. Statistics from AFCD shown that the supply of fresh food imports from the mainland has gradually recovered, and the overall vegetable wholesale price has dropped slightly. It is expected that the overall vegetable supply will continue to stabilize. In addition, many Hong Kong cross-boundary truck drivers have been temporarily removed from the exemption list by the Guangdong provincial government due to the discovery of confirmed cases in the building or housing estate they live in. The task force is trying to expand the pool of cross-boundary truck drivers, including exploring relevant temporary measures with relevant mainland authorities. In response to the request on the Hong Kong side, the mainland has shortened the exemption period to 14 days from this morning and narrowed the scope of the exemption list exclusion for individual residential buildings. Even if those drivers live in buildings with confirmed cases, they can still be exempted as long as they test negative in mainland PCR tests. We sincerely thank the Shenzhen province and the Guangdong province and the Shenzhen city for their support. There are currently about 8,000 active cross-boundary drivers in Hong Kong, and over 80% have completed the third dose of the vaccine. We deeply understand the strict rules of the mainland anti-epidemic and prevention measures. In order to strengthen joint prevention and control, the SAR government has begun to distribute rapid test kits to more than 8,000 active drivers so that they can test themselves before entering the mainland. The working group will continue to explore other measures to reduce the risk of the epidemic spreading brought by the cross-boundary goods vehicles entering the mainland. In the past month or so, many residential buildings in various districts had to be locked down for mandatory testing due to infection cases. From 1st January to February 14, the housing departments coordinated 34 restriction testing declarations (RTD) operations involving 24 public housing estates and more than 63,000 residents, including the unprecedented 7 days restriction on Yak Kwai House and Ying Kwai House in Kwai Chung Estate, and the 5 days restriction in Ha Kwai House. The RTD operations covered 3 buildings in Kwai Chung Estate, involved a total of 2,600 units and about 7,100 residents. Various government departments cooperate with each other in each RTD operations. Take the large-scale RTD operation in Kwai Chung Estate for an example. Various departments have participated and worked overnight on the front line, including coordinating restricted areas, arranging sampling, providing meals for the residents, and setting up hotline for inquiries, disinfection and cleansing, etc. For the Kwai Chung Estate, a total of about 37,000 residents tested, including 60 door-to-door sampling for people with mobility difficulties each day. The RTD operations would inevitably bring inconvenience to residents. However, we hope the public will understand, as Hong Kong is densely populated, and once a confirmed case occurs, we must try our best to cut off the transmission chain. The government will continue to adjust the operational arrangements based on the epidemic development and the operation experience in order to sever the transmission chain and to minimize disruption to residents. In response to the severe and rapid spread of the 5th Omicron wave, additional isolation facilities are required. On February 15th, the Chief Executive announced the requisition of the unoccupied Block 1 and 7 of Green Hills Estate, which has been completed but not yet occupied, and Han King House of Lai King Estate, a total of 3 public rental housing building blocks with more than 3,000 units available as isolation facilities. Some units in the above estates have been pre-allocated. We understand that for POH tenants who have accepted pre-allocation, the temporary use of their flats as isolation facilities would cause them inconvenience. We have sent a text message to the affected prospective tenants as soon as possible on the announcement day, informing them that we will send them a letter soon to provide them with special allocation arrangements to minimize the impact on them. The HA has activated 7 dedicated clinics to treat those confirmed cases with light symptoms but require doctor consultation. In view of the public health risks and the transportation needs of those cases, the Transport Housing Bureau has worked with the taxi trade to create an exclusive taxi route to provide free point-to-point transport between their homes and the designated clinic. The taxi fleet will start operating tomorrow morning. And currently, a few hundreds of taxi drivers signing up. The patients can book through a dedicated platform or a hotline. The government will provide the operators and the drivers anti-epidemic guidelines. There will be a briefing session later today. The drivers must wear the personal protective gear like goggles, a mask, and protective gown, and must disinfect their car whole day. And before starting their shift, they should take an RT-AT test to ensure a negative test results before start providing the service. To reduce infection risk, the passengers must sit in the back row. They won't be allowed to ride shotgun. The exclusive taxi fleet would only take passengers with appointments and would not pick up other passengers. There will be a special logo on these taxi livery for public identification. I would like to thank the taxi trade to organize this taxi fleet in such a short period so that those patients in need can have a safe and reliable point-to-point transport. In response to the fifth wave outbreak, the overall public transport passenger patronage has dropped by 40%, and each operator continued to strengthen on cleansing and disinfection, especially on those with frequent contact with the public. They urge their staff to get vaccinated. The overall vaccination rate is about 80 to 90%, and remind their passengers to pay more attention to the health guidelines and the latest vaccination update and adopt all precaution measures. The Hong Kong International Airport has taken all measures to protect passengers and staff, including the highest risk group must undergo a PCR testing every 2 or 3 days, and to segregate the mainland passengers from other passengers and arrange a different group of passengers, and suspended certain countries from passengers from transiting or arriving to Hong Kong, and the designated airport staff must receive a third dose on the 10th of March. I'd like to thank the members for approving the injection to the anti-epidemic fund, and about 2.5 billion to support various transport trades and practitioners, including the cross-boundary passenger transport industry that was hardest hit, and the aviation industry and the local public transport. And President, fighting the epidemic is the overriding priority at the moment. We are mobilizing whatever we can to adopt all the measures to ensure that our safety and health of the Hong Kong citizens and to ensure the Hong Kong social stability. And hope that the Hong Kong citizens put hands together to cut off the transmission chain and to emerge from the epidemic. I so submit. Thank you, President.
經濟發展局局長。
Secretary for Commerce and Economic Development. With regard to the support in the economic field in the fight against the epidemic, economic support, I can assure you, is in line with what we are doing to fight the epidemic. Because if we cannot win in this fight, we are not able to revive our economy. Therefore, the dynamic zero infection approach means that we have to contain the virus and then we can revive the economy. Last year, when we successfully contained the fourth wave, we were able to allow for 6 months or so some economic rebounds, and some industries got some relief in that period. Therefore, our policy must be to unite everyone, as the presidency has called for, and we should mobilize all resources and implement all policies and work with the government in this collective enterprise. Many members have said in this debate that we should help the industries in distress. I'm grateful to the Finance Committee, which approved very quickly on Tuesday to $27 billion in the 6th round of anti-epidemic fund. From the 7th of January, since the 5th wave started, the government has introduced 2 rounds of relief, because under the AEF 5.0 and the recent 6.0, we have devoted more than $30 billion. In terms of speed and amount of funds and coverage, it's unprecedented. We have heard views that if we can expand the scope and also to pick up the remaining pieces, it would be even better. In the discussion, in those meetings, some industry representative would like us to cover hotels. Therefore, cover more hotels. They want us to cover more hotels. So apart from those receiving subvention from Hong Kong, we are going to cover another 40 used for quarantine and also for transitional housing. They all be covered in the funding scope. So instead of 240, we're going to help 330 hotels. The commitment will increase by $17 million to $118 million in total. We are going to, we're willing to make further improvements if needed, if warranted. Some members would like us to disperse the relief funds by through streamlined procedure. In the 5th round, which we launched in January, the relief was dispersed before the Lunar New Year. Many members have mentioned that apart from the AEF, which will provide direct relief to the industries concerned, I would like to remind everyone that there are other industrial support measures which are adequately funded. There are more than 40 government-operated funds. Half of them still have remaining funds available for example, the upgrading, the fund, the bus fund, and there are funds available for applicants. We are also aware of the cash flow requirements for businesses, and there are calls for the continuation of the 100% loan guarantee scheme. We have reflected such views to the Financial Secretary's Office and the Monetary Authority. It is hoped that we will be able to come up with something in the announcement of the coming budget. As the presidency has said, we must devote all resources available in this fight. And therefore, we are getting a lot of support, huge support in our work. Together with the relevant authorities and ministries and expert groups in the mainland, I will be tasked with ensuring the supply of medical appliances and equipment, together with the DFH, the Hospital Authority, and the HAB. Will be ensuring the supply of essential medical equipment and appliances, including PPEs, drugs, and useful kits such as rapid antigen test kits. And we we are going to offer these test kits to frontline workers, as well as those working in the housing management and cleansing works. And also additionally, we would be giving the same to residents to supplement what we are offering through our testing facilities. The procurement procedure has started, and we will make announcements in due course. Apart from supplies, I've heard also from the members the views on facilities and arrangements. For example, the CE discussed with relevant hotel operators, and more will be provided. More rooms will be provided. And AWE has been committed fully in terms of facilities. And also, if we can make good use of Hong Kong CEC facilities or cruises, we'll certainly do so. I'd like to take this opportunity to thank businesses and individuals for donations that they have made. We are going to receive such donations from them and distribute them to the people in need, and also to use it in our the work against fighting the epidemic. I'm grateful to the Guangdong provincial government in this regard. Some members have mentioned in the debate that we need to look at the information dissemination, and RTHK should play a bigger role. On Monday at a panel meeting, I said that 1 or 2 weeks before that meeting, the RTHK that had already stepped up its work in information dissemination on the epidemic. Channel 32 of RTHK is a instant news channel. It's now been converted into an epidemic information channel. So all family with a TV set and have access to this channel will be able to know the latest information through this channel. And as you have seen in the recent lockdown and testing, RTHK has been heavily involved. They have invited officials to explain the arrangements, and also site visits have been made. And also in the morning now, through Channel 32 from 8 a.m. to 12 noon, the first 5 minutes of the news bulletin will be on the latest information. For example, the compulsory testing arrangements and other related messages. And whether we're talking about Channel 31 or 32, they will be doing more in the dissemination of epidemic information. So if this is particularly useful for elderly people who may not have a mobile phone, and they can just tune into Channel 32, and RTHK will also use its online platforms for the same dissemination. And there are other informative programs involved in this. Members' views will certainly be taken on board when it comes to enhancing our work. And I thank members for the support to our frontline workers, and I'm grateful to the central government for giving this very strong support in terms of policy and direction of work. Because we all know that the economy can only be revived when we have emerged from the epidemic. I support the motion.
Secretary for the Civil Service. President, members, first of all, I'd like to thank you all for speaking in the debate. You've talked a lot about vaccination and also the civil service fighting the epidemic. A lot of valuable comments have been given, and I'd like to speak on those areas. In terms of vaccination, the fifth wave started late last month in the community. It's spreading rapidly, and we have seen exponential increase in the number of cases scattering in different districts, and therefore it's an overriding task for the administration right now, both in terms of tracking, vaccination, and so on. And vaccination is one of the most important initiatives to get out of this epidemic. Well, in the face of this variant, evidence is clear that vaccination may not be able to prevent infection, but then it will be able to prevent serious cases. And therefore, increasing vaccination can also protect the healthcare system in Hong Kong. The free vaccination program offered by the administration since its start in February last year, it's been 1 year now. And I'd like to thank all those that have been involved in the vaccination program, including the healthcare team and also those working behind the scene to provide support. They've been working tirelessly in order to provide the services. Right now, because we still, well, for those who have taken the first jab, that has already reached 5.68 million, accounting for some 84.5% of the total population over the age of 15. And we have already got 5 million that have taken the second jab, accounting for some 75%. And then 1.75 million people have already taken the booster dose. And then for those children, over 50,000 have taken the first jab, and then for those between 12 and 19, many have already taken the first jab, and over 90% of those in the adult group have already taken the jab. For the elderly group, the vaccination rate has been unsatisfactory, and therefore we've been working very hard with local groups to boost the vaccination rate. There has been some improvements, and for those 60 to 69, 80% have already taken the first jab, and 70 to 79, 70%. And then for those over 80, only 40% have taken the first jab, and therefore we will have to race with time in order to increase the vaccination rate for the elders. Right now, because of the demand for vaccination, we have already set aside resources so that with the increase in manpower and also the increase in the vaccination venues and so on, so that the capacity can be boosted, and we have managed to double it within a very short space of time. And there are diversified ways to take the jab other than the community vaccination centers arranged by the government. We have also got over 1,000 private clinics that can provide a service, and recently, if you look at the number of doses at private clinics, that has already reached 40,000. We understand that the public will still have huge demand for vaccination. Many members have suggested that we should increase the places of vaccination, and also the number of jabs should also increase. And some of these measures have been in place already. For example, there will be more community vaccination centers starting from the 15th of February. For February, we have already lowered the age of vaccination for Sinovac to 3. And then we have already submitted this application so that the waiting time after taking the jab can be reduced from 30 minutes to 15 minutes. And in Tuen Mun and Sha Tin, 3 more short-term vaccination centers have been added, and 2 already commissioned yesterday. And another one will be commissioning tomorrow, and there'll be a BioNTech vaccination for people. And just yesterday, there were also 2 other centers that have been commissioned, and next week 3 more will be commissioned, so that for those over 5, they can also take the BioNTech jab. And then starting from Wednesday at the Central Library, there will also be another community vaccination center for those from 3 to 17, and also for those over 60, they can also take Sinovac there. And then the online appointment service will start from Monday next week. And within the short future, we will also be increasing the capacity for vaccination. We will also be working with the relevant sectors so that there can be better coordination and collaboration, so that we'll be increasing or stepping up our work in 3 areas. One, for the elderly group, including those living in RCHEs. We will mobilize and organize more healthcare professionals, so that through streamlining the health assessment and also the flow chart, so that within a short space of time, we can work full steam in order to provide vaccination for those living in RCHEs. And private clinics would also be mobilized so that those living in a community can also take the jab. And through the HAD, We will also be assisting district-based groups so that there can be more outreaching teams providing vaccination service. And then for young kids and also primary school students, other than parents making arrangements for them to go to vaccination centers or private clinics to take the jab, we will also be working with the education sector and the education bureau so that convenient measures will be provided so that schools can also arrange for teams to provide a jab at the community vaccination centers, and outreaching teams can also go to schools to provide vaccination to the students. And also for those who have taken the second jab, and if it's already 6 months, they can also take the booster jab in order to enhance the protection. During the past 2 years, in the wake of the 4 waves of the outbreak, we have already mobilized some 70,000 people who have joined in the different tasks. Other than civil servants, retired civil servants, and so on, they have echoed very enthusiastically to our call. And then for the incumbent civil servants and also for the retirees, in the past 2 years, they've been making a lot of contribution, and we are really grateful for that. And therefore, our first task is to suppress the tsunami outbreak, and therefore we will have to do more tracking, tracing, and so on. And therefore, we need a lot of coordination and support staff in order to ensure that there would be sufficient manpower to cope with the pressing tasks. We've been working with different departments and bureaus so that I would be deploying our staff flexibly in order to cope with the needs. Civil servants, as the core team in serving the community, we would take that as our top priority, and therefore, whether or not it's the staff working in the offices, whatever their original duties might be, they will still stick to the original intention of serving the community, and they will respond to the calls of the departments to cope with the situation. And in order to take the lead and also to reduce social contacts and also reduce people flow in the community, we have also extended the arrangement for work from homes so that only necessary and essential services will be kept, and whether or not civil servants are working in the offices, they will work full steam to cope with the situation. So there has been increasing manpower for this, other than the core departments in fighting the epidemic. In the past couple of weeks, different bureaus and departments have been responding to the call, and they've mobilized a lot of manpower so that within a very short space of time, we have conducted testing and also restricted areas so that there can be mandatory testing. For example, some 1,800 civil servants from different policy bureaus and departments have joined in the task. Every night, several hundred people would also be mobilized in doing the job, and over 500 people have also been deployed for that. And we have also distributed the necessities, and also we have also served in the hotline centers. Well, our top priority is to contain the spread of the outbreak, and most of our staff have already taken at least 1 jab, and therefore, in order to tie in with our policy, in order to promote comprehensive vaccination for the community, we will be setting a good example. And starting from yesterday, in government offices and government premises, we have already introduced the vaccine pass policy. It has been very smooth. Well, the situation is serious, and therefore, we cannot afford to be complacent. And if any civil servant doesn't accept this vaccine pass arrangement, we will take it very seriously. We will also be updating the vaccine pass arrangements so that for premises that would require vaccination, and also the number of doses that would be required would also be updated accordingly. We are really grateful to the central authorities and also the Guangdong provincial government support, as presidencies talk about the 3 O's and also the 2 important matters. The SL government has the main responsibility for fighting the epidemic, and therefore, under the leadership of the chief executive, we have an unshakable responsibility in the face of this challenge. The civil service must do its best in order to work with the community so that we will work together in solidarity to fight the epidemic. With these remarks, I thank the President.
Chief Secretary for Administration.
主席，我非常感
President, I'm grateful to the 80 members who have spoken in the first session and for offering the views to us. I will be giving a comprehensive response to their remarks. President Xi Jinping has given important instructions to the SAR government so that the SAR government would shoulder the major responsibility to fight the epidemics and to stabilize this progression of the current wave. This will be our top priority. We would unite every sector of community, do whatever it takes to fight the epidemic so as to safeguard the health and life of our people, to ensure the stability as a whole for the entire SAR. I'm very happy that all members are supportive of the government's policy of achieving dynamic zero infection. As the fifth wave is progressing viciously, and there's a hectic increase in the number of confirmed cases, the SA government has doing its utmost to mobilize everyone to respond. We have taken resolute measures such as local lockdowns, testing, tightening social distancing measures, because the Omicron variant is very transmissible, it's highly transmissible, and it has overburdened our systems. So we have adjusted our measures accordingly. For example, in January, in the initial stage of the fifth wave, we assigned additionally 100 discipline service officers to Kai Tak, which is where we have the tracking command center, so as to enhance our capability to track the virus. And since there's a hefty increase in the number of quarantined people, the Choco One, since January, there are problems such as delays to checking and no one taking increasing number of hotline calls. We increased the number of manpower from 600 to 1,000 instantly, an increase of 2/3, and also to increase the arrangement for information dissemination by adding additional hotlines. And because also there are people who waited for hours for testing, we have mobilized civil servants and volunteers to help maintaining order of these queues, and also to make sure that the people in the queue can check the time required for the queuing and to ease the long waiting list. And also to help those who are put under home quarantine and their family members, we set up a 24-hour hotline since the 10th of February, and there's also a hotline offered by the hospital authority for inquiries for those waiting to be admitted in the community. And we have also arranged a taxi fleet to take those with minor symptoms to 7 designated clinics, and also to help them, to help the confirmed cases with minor symptoms. We know that we have asked venue managers to check the vaccination records. And we believe that the tracking function can be enhanced through this requirement. I've heard from many members that they would like the government to act more speedily and to deal with the frontline situation more quickly. Well, we are all going for speed and effectiveness in our measures, but because of the current outbreak, the number of cases have overburdened the existing capacities. Therefore, we came short in some aspects. I'm grateful for everyone who have supported us in this fight. With the support of the central government, I believe the SAR government is well equipped to get ahead of the situation. I've been coordinating the work of the five working groups to dovetail and to liaise with the efforts of the mainland counterparts. We would compress the lead time required, but this is something that will cover a large area and many aspects. Therefore, we have to prioritize. Some would take priorities in the short term, some would take longer time to get done. First of all, we would stabilize the food supply. the THB and the Food and Health Bureau and the CMAB will be coordinating the entry and of truck drivers. We will work with Guangdong provincial government and Shenzhen government to ensure supply. This is what is being handled by the working group on supplies from the mainland. We have been working with the mainland authorities to ensure the steady supply of necessities and food. Second, we are going to have experts coming to Hong Kong to assist us. The expert group has been set up to ensure that very quickly mainland experts will be coming to Hong Kong to help us with the tracing and tracking work of convicted cases. And also we have procured 100 million test kits, rapid test kits, and the CEDB would, as a matter of priority, distribute such kits to the high-risk groups such as residential care home for the elderly. And we are also going to liaise with different sectors and distribute the kits accordingly. The other expert groups will require more planning and preparation. Therefore, more time is needed. For example, the CMAB, Secretary for CMA, would liaise with the mainland on the best and effective rapid test to be used and how to enhance our capacity for testing. For example, if we are to import testing personnel from the mainland, how many will be needed, and also what's the division of labor between Hong Kong, SAR, and the mainland, or should some of the work be carried out in the mainland? We have to make sure that the assistance from the mainland is sufficient. When this is done, we'll be able to implement different testing programs. This would quickly enhance our capacity so that we can prevail over Omicron and suppress the trend of increasing number of cases. As for the working group of expert, the development bureau testing facilities, the development bureau has been looking at possible sites in on Lantau Island. We want to make sure that we can construct quarantine and testing facilities more efficiently. The SAR government has already announced that newly completed housing estates, for example, those at Queens Hill or Light King, some 3,000 units will be used for isolation for the time being. And we have also identified 4,000 hotel rooms for the same purpose. 1,700 will be commissioned this week, and the remaining rooms in the following week. We are going to continue to source more hotel rooms for this purpose. We need the community to be fully involved, and everyone should participate in this fight against the epidemic. We must understand that the only enemy before us is the virus, is COVID. Our healthcare system is facing unprecedented pressure. We are appreciative of the community's understanding and support. I appeal to all people and all sectors. And many people and businesses have said that they would like to contribute. This is in line with President Xi's instruction that we should mobilize all resources available. We will organize volunteer groups to do liaison in the districts to assist those who have been put under compulsory testing and distribute relevant materials such as kits and to maintain order of the queues. And we will also provide information platform to disseminate information on prevention. Hotlines will be set up to assist families with young children. And we will also deploy healthcare personnel to provide the jobs in residential care homes for the elderly. And we will speed up the vaccination program so that more can be vaccinated first. On the question of providing PPEs, that will provide the supplies to ensure sufficient supplies are provided, so that we can emerge from the epidemic. I thank all the healthcare and online personnel for being diligent in discharging their duties. I thank everyone in the community, including security people, the cleansing workers, and workers in the residential care home for the elderly for their diligent performance. And I thank all volunteers, civil servants, and everyone who has played a part in the fight. Like all the people in Hong Kong, I'm grateful to their contribution. The debate has assured me that we are now in a full operational mode, and we are going to prevail over the only enemy before us, that is the COVID virus. We must stand united. Government and community resources must be united so that we are strong enough to fight this virus, this epidemic with full force, so that we can demonstrate that a new culture of togetherness. We must be united. We will certainly be victorious in this fight, and our life will be resumed to the normal very quickly. So I submit, President, that the first debate session ends. The Council now proceeds to the second debate session. Members who would like to speak should click